I'm Dolly, and I am a bail bondsman, have been for 31 years. I'm also a real estate broker, have been for about 35 years, and I also used to teach school. For the last 4 years, I have been complaining that my legs are so heavy I can't walk very far. And I went to 4 different doctors, and none of them could say exactly what it was. My very best friend goes to Dr. Pittman, and she said, listen, go see Dr. Pittman and see if he can tell you what's wrong with your legs. So, thank God I did. I came to see him, and the first thing he said to me when he entered the room was, hi, how are you? And do your legs feel tired and heavy? And I said, oh my God. I said, you're the first person that understood what I meant when I said my legs feel heavy and I would say fatigued. None of the doctors, 4 of them, even my general practitioner that sees me every year, none of them diagnosed me until Dr. Pittman. Hi, Dr. Pittman.
Miss Balding, how are you doing?
I'm doing pretty good.
In your Velcro wraps.
Right.
In your new cocoons.
It's an ordeal, but I'm doing it.
Yes,
Yeah.
You're doing it, and we have your legs in this little cocoon, and you're going to come out a butterfly.
I hope so.
It's going to be a little while.
I have some questions.
Awesome.
Okay.
I like questions because I got answers.
Okay, question number 1. What stage would you say I am in?
Have you been on the internet?
I've been on Google.
Good for you. I believe in all of that. You know I'm a 24-year cancer survivor.
No, I did not know that.
Yeah, and the internet was my lifeline 24 years ago, and so I do believe in it. It's important. There you can get a lot of great information there. So yeah, there's 3 stages of lymphedema: 0, which is nothing, then 1, 2, and 3. I think you're in stage 2, so fairly advanced, but not beyond help.
See, I thought I was in stage 3, and I was worried.
I don't think you are. I don't think you are.
Well, one of my questions was, when I was reading in it about stage 3, they talk about getting little bumps here.
Yes.
I've gotten a few of those.
Okay, but you don't have a lot now.
No.
And believe it or not, again, I said if you commit to this process, it will improve, okay? It will get better. And we do reduce people's stages here. And no, I've seen a lot worse than you got. I think you're stage 2, and we can definitely get you back to stage 1, doing all that stuff.
All right, is this for the rest of my life? Whatever's left.
Well, I got short answers and long answers.
Give me short.
Yes.
Okay.
It's like, you know, do I want to wear these the rest of my life? No. But I didn't get these till I was after 40, and I'm not telling you how old I am. It's just a number anyway. But I don't like these darn things, but I can't see if I don't wear them.
Right.
And I wish people couldn't see if they didn't wear their Velcro compression wraps. But unfortunately, swelling generally doesn't cause a ton of symptoms. But yeah, for the time being, I would just get used to the idea. I love Velcro compression because they're not that bad. You'll get used to them.
Well, I am getting used to them. But is there a point where I would just be in compression stockings and out of the Velcro? Will I ever grow out of the Velcro?
Yes, you can absolutely do that. And look, it's not something you need to do all day, every day. You can take them off for a cocktail party. You can bare your legs. Again, these are going to improve. Your legs are going to improve. You're going to like the way they look, and you can take off compression for a few hours and show them off and be the way you always have.
Okay, but as far as the stockings go, I should always wear them daily.
Again, you can even take stockings off. I'm saying you don't have to wear compression hose or stockings or the Velcro wraps all day, every day, forever. You know, it's like a cheat day, right? You know, you're on this diet for 6 days, but you know, you can take a day off as long as you're being good the rest of the other days. You can absolutely do that. Absolutely.
Well, I've been really good. And something else you told me, you said, very important is keep the feet moving. Don't dangle them. Keep them moving.
Correct. Remember, 3 hearts. That's right.
Yep.
We got 3 hearts, ladies and gentlemen. 1 here and 1 in each of our calves. And when our calves are moving, okay, it's compressing those important veins in your muscle, pushing blood up and out of the leg. But it's actually activating your lymph system too to get all that fluid out. So here's what I tell people, you know, obviously get up and do this, right? You know, people can do this. A lot of people don't realize you can do this too.
I do that.
Okay, and activate what we call that anterior compartment.
Yeah.
But you don't need a bunch of resistance to move lots of blood and lymph out of the leg. So if you just do this.
I do.
Okay, that's helpful too.
Yeah, I do.
So I would say what you got's great, but if you want it to be even better, I would make that calf move. You got to activate the calf pump. And so that's why I tell people, you know, be a ballerina or a NASCAR driver, you know, whatever you want.
Yeah.
But this is kind of the primary mechanism.
I have been doing that some too.
Doing that. So the thing that, you know, what's most exciting to me?
What?
You're engaged and you want to get better.
Well, of course I want to get better.
But that's not everybody.
Really? Well, okay, I certainly want to.
So that's thrilling to me because you're engaged, and like I told you, if you do a few things, we do a few things, you add them up together, and you're going to have new legs, and you're going to be a new lady in 6 months.
That would be wonderful. How about, let me ask you this. How important is it to like lay on the floor and put your legs up against the wall, elevate your legs?
So elevation has been recommended by doctors for forever, right? You know, go home and elevate your legs. But this is America. People don't sit around, you know, doing this. So in this office, it's the last thing I recommend, and frankly, I never mention it because, and I may have mentioned this before, what's more important is these fantastic Velcro wraps. Can we show everybody?
Yes, we can. They're great.
Yeah, so these Velcro wraps are the most important thing, okay? And then after that, it's the exercise kind of things that we just went over.
Yeah.
And I would say the last thing, or maybe even, you know, further down the list, is the elevation part. So you're not like, you know, most patients, but I don't want patients to get the idea that, oh, I can just go home and do this, and I'm doing something, okay? And then they don't wear their compression wraps. This is good exercise. They don't wear their compression wraps, and they don't exercise. And so I don't want them to get the idea that if I do this all day, every day, it's good for me. Because immobility or limited mobility is not, we're not built for that. That's not what humans are about. You got to move more. And the more you move, the more your swelling's going to improve, the lymphedema stage is going to improve, and the more you wear those. But if you're doing the compression wraps and you're doing the exercise and all that, elevation's fine and not a bad thing. But let's face it, we're elevating for what, 5-8 hours every day because we're going to bed every night.
Well, but I'm that in bed. My legs are more flat. Whereas, like this morning, I have an exercise pad. I do some work for my back.
Yeah.
And then I prop my legs up against the bed because I was down on the floor. So I thought, well, that might be good to get the blood moving on up. I had on my compressions when I did it.
Yeah.
But it's not necessary. What you're saying.
I don't think so.
Okay.
I think if any benefit would be what we would call marginal or minimal. And I think just going to sleep every night, keeping your legs at the same height as your heart is all you need.
Okay. And I don't sleep in these, though.
You don't have to. And you probably notice that your swelling gets a little better overnight.
It does.
Right?
Oh, when I first get up, yeah.
Exactly.
But if I don't get these on right away, I'll start swelling some. Although I am down, I noticed, because I always used to have bird legs, and so I'm not used to them being kind of hefty here.
Yeah.
But
we're going to get you back to bird legs.
Good.
What kind of bird you want to be?
Well, I have to think about that one. I've got another question. Can this move on up? Like
the lymphedema?
Yeah.
Again, short answers, long answers, no.
Okay.
If it's edema above the knee, usually has other causes like organ failure that a lot of us are familiar with, liver, kidney, lungs, heart. Swelling above the knee, very unusual in just venous-related lymphedema, or what we call phlebolymphedema, or the kind of lymphedema that you have. So no, that would be extremely unusual. Do you remember what we told you about when to put these on?
You told me the minute I get up to put these on.
Why?
Well, before it gets a chance to swell again, I suppose.
She gets an A+. Were you good, Steve?
Yeah.
I can tell. So yes, you get an A+ because swelling that gets better overnight is actually a great sign in someone with lymphedema. It means we can do that improvement. Okay, if you were stage 3 or severe stage 3, that would not happen. But the fact that it's getting better means that, again, you can get significantly better with the treatments and the management that we're doing for you. But most swelling recurs within 30 minutes. People getting up and just boom, pours right in.
Yeah.
So that's why to get ahead of this, and I know you're competitive and should be on this, is you want to put them on within 5 minutes of getting up. And you're going to keep them there, you know, where they are, and then you'll go the course of the day, and then you'll do all those exercises and other things. You'll be elevating overnight, and then you're going to do it right back over again. And that's how you get really big gains.
In degrees, as I go, do I make these tighter?
Yeah, absolutely.
Yeah, because I think I can go tighter.
Absolutely. Questions, comments, criticisms?
No criticisms. I'm happy as I can be with you. You are the only one in 4 years that has told me what is wrong with me. I went to another vascular. He wanted to do a stent. I went to my primary. She had no idea. I went to my neurosurgeon, who stuck me with all kinds of things and said, oh, your nerves are fine. I said, yeah, but my legs are heavy. I can't walk far. He never could tell me what was wrong with me. Went to 2 dermatologists because I had the rash that started here. And it was there like almost a year, and I said, well, I've never had a rash like that. So I go to the one that I've been going to for 30 years. He gave me a cream, okay? For 6 months, I put this cream on, nothing. So I go to a different dermatologist. She gives me a prescription. I take it to the pharmacy. It's the same cream. And it did nothing anyway. It doesn't get rid of the rash. What I think will get rid of the rash, I believe, is this.
Oh, absolutely. That's
Yeah.
what it's all from.
But the thing is, in the beginning, seeing that rash that was about this size, you would have thought somebody would have had the intelligence to think it might be something vascular.
Well, that's why we're doing this show.
That's just what people need to see.
Because you are in a big boat. People suffering all over this country because this goes unrecognized. That's why we're doing this show.
Now, I have a bike, a stationary recumbent bike. That's good to use, isn't it? Because it keeps you moving.
Any kind of exercise.
Yeah.
Exercise good for mind, body, spirit, veins, lymphedema.
Yeah.
Move, move, move. Don't stop moving or you die.
Well, that's true anyway. Yeah.
Yeah.
Don't retire.
No, I'm not gonna.
Me neither.
Great to see you.
Nice to see you too. Thank you for answering my questions.
You're most welcome.
And I'm very, very pleased that you're my doctor.
We are just getting started.
I know, yeah.
Yep. All right. Thank you.